People who got moderate or severe COVID infection, they had increased chances of heart attack, at least up to 18 months after COVID. Vaccine saves many number of lives as opposed to, the complications that were attributed to the vaccine. With the introduction of corporates into the healthcare, things have really changed. And that has changed people's perception and also the relationship between the doctors and the patients.
यहाँ पे डॉक्टर्स को तो भगवान का दर्जा दिया जाता है.
सोसाइटी ने हमारे पढ़ाई के लिए जो है पे किया है, and what we are today is because of that. So we are here because of the society. So we have to give back to the society. आपके पास अगर wealth है या आप इंश्योरेंस से covered हैं, तो health is easy for you. If you see in a patient who has got beaten up heart, the heart just beats like this. It is just hanging by a thread. Once you give him a good heart, and you see that heart beating immediately.
आपने कभी ग्रेस एनाटॉमी टाइप का शो देखा है?
Yes.
How realistic do you think it is?
It was close to reality.
Really?
Yes. There is a broken heart syndrome, very immense level of grief that can cause the heart function to go down.
Welcome Dr. Rahul Chandola to AfterHours Season 4 powered by Catch. It's a pleasure and honor to have you. I just want to tell everyone that Dr. Chandola is a senior cardiothoracic and a heart and lung transplant surgeon. So I feel like I'm in very esteemed company today.
Oh, thank you so much. Thank you for inviting me here.
You know, one of the reasons why I really wanted to have this chat with you, sir, was because, again, these are just stats that, we've been reading around us. We've kind of seen a sharp increase in the number of people who've been getting heart attacks.
Right.
I'm told that 30% of India's population actually dies because of cardiovascular disease.
Right.
Why are so many people suffering when it comes to their heart health?
You're right. Cardiovascular diseases are major cause of death, not only in India, across the world. And the reason is, our lifestyles have changed recently. As you see, we're not what we were 30 years ago, right? So, our lifestyle has changed. People have become more sedentary, especially in the COVID time. You remember that people were staying at home, not doing really exercise. People were stressed, and there was a lot of anxiety, what's going to happen tomorrow. They may lose their job also, right? And that's why during the COVID time, the incidence of heart diseases really jumped up.
Yeah.
And especially during COVID, one thing that happened was COVID infection. People who got the COVID infection, it was seen up to 18 months they had increased atherogenesis in the heart.
What is that?
What is meant by that is that there was increased plaque formation in the vessels that were supplying the heart during COVID time, especially in the patients who have who got moderate or severe level of COVID.
Yeah.
And that's why you would have heard that a lot of people, even the young people, we saw a lot of people dying.
Yeah.
With heart attacks. And especially this was the phenomena which was seen up to 18 months post-COVID. Studies are going on, and there would be some effect, that would persist, for, many more years to come.
Yeah.
So at the same time, our diet, if you see, diet has completely changed now. Now what we are eating is outside food, junk food, children right from their very early years, they are into the junk food, right?
Yeah.
So the atherogenesis actually starts, the plaque formation in the heart, that starts very early on.
Like as young as children?
As young as children. You will be surprised, even the neonates,
Really?
Yeah, the plaque deposition starts happening from the neonatal time, and depending upon, what the exposure is, what kind of food do you eat, what is the stress level.
So that's why the mother's nutrition is very important, because
Absolutely.
since then it starts developing?
Absolutely. So it's very important to have a healthy nutrition when you have a small baby, feeding your baby. At the same time, the children right from their early years, we have to inculcate good habits, eating habits have to be good. And they have to be educated about, that what is calorie-rich food,
Yeah.
what is junk food, what is trans fat, all of that has to be taught to the children, I think, in the very early years.
I agree. But like when I talk to my grandmom,
Right.
and she says things like हम तो पूरा एक इतना bowl of butter खा लेते थे,
Right, right,
कुछ नहीं
right,
होता था,
right,
and now everybody is falling sick. And I
right,
and I do wonder what it is that we were doing nutrition wise back in the day, as you said,
right,
30 years ago,
right.
that we're not doing now. मतलब क्या फर्क है अब?
Yeah,
Outside of the junk food, which is
right.
an obvious
So
thing.
फर्क एक तो ये है कि stress levels have gone up.
Hmm.
You compare your grandparents. They were not that stressed out. Yeah,
Hmm.
day-to-day struggles were there.
Hmm.
Average Indian, there were day-to-day struggles. Like monetary issues were there,
Yeah.
but they were not that stressed out as we are today.
Not as
There's a
competitive
rush.
as well.
Yeah. There always is a rush. We are hurried. All the time we are in a rush. We don't know where we are going.
Hmm.
You talk about the young people. People working in the corporates. Young people, they are worried about something. And what is that thing? They don't even know.
The
What that
next
thing is.
promotion.
Next promotion, the competitive
Yeah.
atmosphere. Whether they are going to retain the job or not. It's a very competitive world in today's time.
Yeah.
Previously, people used to be in the jobs. They used to join the jobs and they would retire there, right?
Yeah.
Yeah.
The same place.
Does that happens now?
No, I almost never.
Almost never, right?
Yeah.
People are changing jobs, every second year, right?
Hmm.
And that's happening because, either they are not satisfied in one job.
Yeah.
They want job promotions. There's always a rush,
Yeah.
and it's a very competitive atmosphere that has developed recently.
Is
And
it fair to say that ambitious people have a higher predisposition to sort of cardiovascular diseases than the others?
I would say not the ambitious. You can be ambitious, but that doesn't mean that you are stressful. There's
Fair.
a stressful situation there, right?
Yeah.
So if you know how to cope with the stress,
Hmm.
that's fine. You can be ambitious. You can be really competitive. But if you know how to handle your stress,
Hmm.
that's not going to give you a heart disease.
Hmm.
You'll get the heart disease if you take the life in a very different way.
Hmm.
Any small stimulus, excites you. Excites in the sense that bothers you. You're worried about the small things,
Hmm.
that you can just ignore,
Yeah.
right?
True.
So if you get stressed out with the small things, think too much, overthinking, you're not getting sound sleep,
Yeah.
and on top of it, your lifestyle is haywire, and you are leading a sedentary lifestyle. You're not exercising enough, right?
Hmm.
Most of the time, people are in front of the computer, and they're not even walking, those bare minimum steps that you need to walk in order to keep your heart healthy.
Hmm.
So all these things are leading to increased incidence of heart issues.
Hmm.
And especially after COVID, what happened in the COVID is people who had moderate or severe infection with the COVID virus,
Hmm.
they had increased plaque formation in the coronary arteries,
Hmm.
the arteries that supply the heart.
Hmm.
And as a result, uh, up to 18 months, there are studies, it's well documented.
Hmm.
People who got moderate or severe COVID infection, they had increased chances of heart attack, at
Hmm.
least up to 18 months after COVID.
Yeah. My dad was
Yeah,
somebody who got it as
yeah,
well.
yeah, yeah,
I think one of the scariest experiences
sure.
we've had as a family, because obviously, we've always seen him as this really, really
Really
sort of
active.
fit man,
Yeah, yeah,
and he climbs up, 20 stories at sight,
sure,
and he still does. And, to see him like that,
sure.
somehow we just never imagined कि उनको हो जाएगा.
Right,
Because he's very healthy, doesn't drink, doesn't smoke, vegetarian,
sure.
तो
Yeah,
and very active physically also.
yes,
So, and he did get sort of COVID, and he was like, very stressed
sure.
at that point in time as well. And I'm
Right,
guessing all of that played in.
yeah,
But, one of the things that has been, of course, chatter on not just the internet, but there's been a lot of debate about what the impact of the vaccine was.
right,
Because obviously we were all recommended to
right,
kind of take the vaccine, and as did, I would
right,
imagine, most of us.
right,
But इतने लोग बोल रहे थे कि वैक्सीन क्योंकि इतनी ट्राइड एंड टेस्टेड नहीं थी
right.
एंड बहुत फटाफट डेवलप हुई थी, तो उसका एक नेगेटिव इम्पैक्ट ये है कि उसकी वजह से बहुत लोगों की sort of heart health खराब हो गई है. What is your take on that?
There were many people who were not vaccinated, right? And by the end of the first wave, people started having the vaccine became available, right? And then the vaccine, people took second shot, third shot as well. So vaccine actually saved millions and millions of lives, right? It's understandable that, there wasn't enough time to develop the vaccine.
True.
And we did not know, there were not studies enough that could document that, this vaccine is helpful up to that many years, right? Those studies were not available. But then, of course, there would be some complications. There are some known complications with the vaccines, but those complications were very small, and it's very difficult to say that people who had heart attacks, post COVID, that was a consequence of vaccine. It's difficult to say. I would say vaccine saves many, many number of lives as opposed to, the complications that were attributed to the vaccine. So I would say vaccines really saved millions of people, who could have died because of florid COVID infection.
But you're saying basically that catching the infection increased the development of that plaque in the arteries,
Yes.
which is why the younger 30-year-olds, 40-year-olds were
Right.
actually getting heart attacks.
Yes,
Is that
absolutely.
fair to?
Yeah. That is one of the reasons. But then you have to also understand that, people were working before COVID, and one fine day they were all, incarcerated inside their homes, right?
Yeah.
It was all banned. You can't move out of the house,
Correct.
right? So everybody was in their home, and living a sedentary lifestyle after that. For months to come, they did not move out. And what they were eating was all the food from outside. Everything was open, right? People were getting food from outside. The same time, they were not exercising, living sedentary lifestyle, and plus the anxiety that you or your near ones, anyone can die because of COVID, right? That was the anxiety. On top of it, people lost their jobs. They were not working. They were working from home. Initially, they were being paid by the companies, but then, later on, even the companies refused to pay, right? So a lot of people lost their jobs, and there was an anxiety that, anybody can lose job tomorrow, right? So all of that combined together led to increased incidence of heart diseases, during COVID, after COVID, and plus, as I said, increased plaque burden, that the COVID infection caused. That also led to increased number of heart attacks post COVID.
One of the things that, of course, I mentioned my father's heart attack. One of the things that really was a saving grace for us was my mother identifying that he was having a heart attack.
Right.
And she was, equipped to understand what, the marker of a heart attack is, because if left to his own devices, वो तो नहीं जाते hospital.
Right.
उनको नहीं, वो मान ही नहीं रहे थे कि उनको heart attack हो रहा है.
Exactly.
What are easy signs to pick up that this person is experiencing a heart attack and should now be rushed to the hospital?
So number one thing is to understand that, there are two basic symptoms of heart disease. Number one is chest pain, and number two is shortness of breath. So if you are having chest pain, specifically chest pain on the left side, which is even radiating to the arm or to the forearm, it can radiate to any other part, and it radiate to the jaws also. Some people also complain of pain in the back. Some patients also will have radiated pain to the opposite shoulder. So radiation could be anywhere, but importantly, if you are having chest pain, also if there's a relationship to exertion, like if you're talking, if you're walking, if you're doing any kind of exertion, and that aggravates the pain, this clearly indicates that, it is related to the underlying heart disease. And the second symptom is shortness of breath. Some people may not have chest pain, but they have shortness of breath. Specifically, when they walk, they do some kind of exercise, and the shortness of breath is in excess of, what is expected.
Yeah.
Right? Like you're walking maybe, 20 steps, and that is making you short of breath.
Yeah.
Right? At the age of 50, this is not
not expected at all.
Expected at all, right? So that means there is a problem, that needs to be interrogated. So these are the two main symptoms of underlying coronary artery disease.
But it's so fascinating you say that it's not always chest pain, because एक तो one assumes कि left side में अगर हो रही हो तो आपने बोला और भी जगह radiate हो सकती है वो.
Right.
The other thing you said is you may not have pain, but you may have shortness of breath.
Yes.
I feel that would make sense given the number of cases that have happened where people are in the gym
Yeah.
on treadmills,
Yeah.
not having been able to identify that that shortness of breath minus the chest pain is actually
Yeah.
a heart attack.
Yeah. Yeah.
Because, that also, again, this is just stuff that we've been reading in the last couple of years.
Right.
And the number of people, who I've even anecdotally heard of who've literally just been in the gym.
Yeah.
And gotten a heart attack and not known it was a heart attack.
Right.
And just died immediately has been scary.
Yeah. Yeah. This is scary. And at the same time, so what's happening in these patients, the younger people, who are dying? There have been so many celebrities who died off late, and they were young, like in their 40s or 50s. They died. So what happens is they had some underlying coronary artery disease, some plaque burden in the coronary arteries, and then when they do excessive exercise, when you are at rest, your heart is good enough to provide blood supply to the rest of the body. That's fine, right? But if that plaque is there and you are exerting yourself to a level where your body demands so much of blood, right? Heart has to work really hard to provide that much of blood.
Yeah.
But then there is an obstruction in the arteries there, which was good enough to supply you blood, when you were at rest, when your requirements were less. But now your requirements are almost 2 times, 3 times, 4 times the normal requirements, right? When you are doing very heavy exercise. At that time, the heart is not able to provide you that much of blood, right? And that time the catastrophe can happen. So it's important that for everybody, anybody who is more than 40 years of age, or even in younger people, who have, high risk. By high risk, I mean if you have a family history, your dad, your mother had a coronary artery disease,
a genetic predisposition,
right? Genetic predisposition is there. Or if you have hyperlipidemia, certain people have got high cholesterols, even the younger adults, even the adolescents have, right? So if you have high lipid levels, if you have genetic predisposition, if you have underlying diabetes, right? Underlying hypertension, right? If you are very stressed out, if you have anxiety disorder, right? All these are very high risk situations, conditions, where people even younger than 40 years, they should get themselves checked. Yeah.
This has motivated me to definitely get myself checked, even though my cholesterol, I get, my blood tests and all done
right
regularly enough, and it's usually fine. But
and plus obesity,
yeah,
right? That is such an important thing, So,
but अभी आपने mention किया कि लोग बहुत बाहर से खाना मंगाते हैं, junk food, and how nutrition is a very, very important part of ensuring that one prevents themselves from any sort of diseases, of course, heart health included. There's again been a lot of chat on whether gluten is good or not. हमारी जो old ancient eating habits थी ना, ghee, gluten. What do you say about, like, should we go back to the way we used to eat before, or should we modify it to how people perceive good eating to be today?
Right. So, as I said, not only one thing. It doesn't have to do only with the nutrition, right?
It's everything together.
Everything together. And the overall effect of rest of the things, that's huge, right? If you take out all these rest of the things, like, the lack of exercise, the stress levels, the highly competitive atmosphere, obesity, right? So all these things have a higher, burden on you, on the heart, as opposed to the nutrition alone, right? But then at the same time, if we have the home cooked meals, and if we are aware that, we have to take all the components in right proportion, right? We don't have to overeat there, right? We don't have to take too much of calories, and not too much of fried food. See, in ancient times, there wasn't too much of fried food, was it? Yeah, not much, right? Now, the we are having junk food. We are having, a lot of preservatives, a lot of these namkeen, bhujia, cookies and all that. What's that? It's all trans fat. right? Carbohydrates along with the trans fat.
Yeah.
That's absolutely bad for the heart. And younger generation is consuming more of that, right? We are eating out. What's there in that food, right?
Yeah.
It's all not good for heart.
Yeah, I mean, of course, क्योंकि खाना सिर्फ खाना नहीं होता. It's also like
Yeah,
clearly determining your heart health and
right.
everything else. So home cooked meals,
Yeah,
are I presume ideal.
yeah, they are ideal.
But मैंने एक video देखी थी where somebody was asking a bunch of very very sort of highly qualified cardiothoracic doctors, and they were just like, what is the worst thing that someone can do for their heart? And they said smoking.
Smoking is bad.
Yeah.
Absolutely
But
bad.
if I asked you,
Yeah.
Dr. Chandola, that between smoking and drinking, what is better? What would you say?
Yeah, that's a tough question. But again, if we're talking about the heart health, then smoking is the bad guy. It's the worst guy.
Yeah.
You can think about. Because this is smoking can damage the heart. Many more times than any other thing. If somebody smokes, and you'll see people like that, who smoke 8 to 10 cigarettes a day.
Yeah.
That's disastrous. Your heart is taking too much of toll. The first thing you do is stop smoking. Rest of the things can be managed. But smoking, heart cannot deal with it.
चलो आपने बोला नहीं, obviously आप क्यों बोलोगे कि drinking is better than smoking? But clearly
Yeah.
there's one greater evil, which is
See,
smoking.
the thing is, drinking, there was a time. So initially, drinking was thought to be bad for heart. Very old days, right? And then the concept came that, some studies showed that drinking, mild to moderate levels of drinking, maybe 1 or 2 drinks a day,
Yeah.
are okay for heart. This was a concept. Now the concept has changed again. In the last couple of years, the research is out that any level of drinking, even if it is a small peg a day, that's not good for
That's
heart.
harmful.
That's harmful.
Yeah, because पहले I remember जब हम college में होते थे, and I was in London, and the Italians used to talk about how a glass of wine a day is like
Right.
good for the heart.
Yeah.
And I used to wonder, but it's alcohol. How
Yeah,
can it
yeah,
be
yeah.
good for the heart?
Yeah,
But
yeah, yeah.
there was definitely, as you said,
Yeah. So there was an
a
era,
time. Yeah.
almost like 2-3 decades when it was a common belief that one drink a day is not harmful.
Yeah.
So the concept was 2 drinks a day for men and 1 drink a day for women. That's fine for heart. Yeah. So, but then now the concept has changed. Recently, the new thing is the research is out. Any level of drinking, be it
Just
a
bad.
beer, wine, or alcohol, any kind of spirit, in whatever concentration, is bad for heart.
What about vegetarianism or non-vegetarianism? Like, is there a preference when it comes to heart health? Like, is being a vegetarian better, or is eating like white meats or red meats better?
Yeah, so it's very clear that red meat is bad for heart. Uh, it's not good at all. So you can't eat mutton, you can't have beef.
Yeah.
You can have the other non-vegetarian food. You can have chicken. But try to have it home cooked. Home cooked chicken is always good. You can have fish. Fish is good for our heart. Gives you a lot of omega 3 fatty acids. And it's good for heart. Even we recommend fish to patients who are recovering from heart surgery. So after bypass surgery, after valve surgery, we start telling patients, after 3 or 4 days, you can have maybe a serving of fish, every day. That is helps in healing the heart.
As a vegetarian, मैं तो supplement ले लेती हूँ. I don't think I can have the meat. But अभी तो चलो, we figure out that stress is a major sort of cause of bad heart health. We know that lack of exercise is definitely an issue. We know that eating bahar ka khana, which is not sort of rich in nutrients, is not sort of conducive to heart health. But now that we know all this, and of course with everybody's sort of schedules, one would try to incorporate all of these factors. But what would you say has been like new in terms of the technology or innovation where, one can monitor this a little bit better?
Right.
Outside of course making sure that हम ये सब तो कर ही रहे हैं, ऐसा कुछ नया आया है जिसकी वजह से we'll be able to kind of monitor our heart health a little bit better?
Yeah, absolutely. So the technology has gone to a level where, we can monitor your heart health in real time, right? Things are going to change in healthcare because patients will be, what we want is, we don't want patients to come to a hospital for treatment, right?
Yeah.
So what if patients can be treated while they're sitting in their home? What if their chronic conditions like hypertension, so you see, almost 25% of the population is suffering from high blood pressure, right? Close to 10 to 12% of the population has got diabetes, right? People are having low backache. And these are the common reasons why people are going to the hospitals, right?
Yeah.
What we have to do is, what we are telling people is, you don't need to come to hospital. We will ensure that we take care of your chronic health conditions while you're sitting in your home, right? And how do we do that? So we leverage the remote patient monitoring tools, right? So the technology is available where there are wireless biosensors, and these biosensors are sort of ECG patch that you can put on your chest, and these transmit signals to the iCloud platform.
Okay.
And from iCloud, the signals get transmitted to the heart command center. So we have a command center where our team monitors all these signals which are coming from the patient's side, right? So the patient can be, say, in a very remote village in the country. Say last village in the country is, I believe, Mana is one of the villages in close to Badrinath, right? That's the remotest village you can think about. It's on the border of India and China. And so the patient is there, right? He's got a heart attack. He was admitted to a hospital and then he got discharged from the hospital. But who is going to monitor him there? Who's going to monitor him, right? Nobody. And he has no access to health there.
या मतलब वहाँ पे कितने हॉस्पिटल ही दूर-दूर तक मिलने हिल
मुश्किल है.
स्टेशन वगैरह में बहुत मुश्किल है.
Right. तो हमने उनको बोला, this is a real story that I'm telling you. So there was a patient who was from Mana, because I am from Uttarakhand, patients keep coming from Uttarakhand to me, right? So he came to us with a heart attack. Now he's going home. Who's going to monitor him there? And most of the complications, after a heart attack, they happen in the initial 1 month after getting the heart attack.
Yeah.
But there is nobody to monitor them. So what we did was, we put a patch on him. This patch contains the wireless biosensors, and the technology is so ripe now that all these signals get transmitted to our heart command center. Now this patient has gone back to his village, but he is being monitored in real time by our team of experts in Delhi.
That's
right?
Amazing.
And if he had those arrhythmias. Sure, he did have arrhythmias, after 10 days of reaching his village. But then we were able to identify those arrhythmias, and we modified his medications accordingly, right? These arrhythmias could have gone undetected, and patient could have some fatal complication at home.
But अभी जैसे आप जैसे बोल रहे हो वो बायोसेंसर्स कैच करेंगे जो भी हो रहा है.
Right.
You will be able to monitor
Right.
let's say these arrhythmias etc.
Right.
Then after that what happens?
Now we have a service, so we call that as iLive Connect service. So in that service we have a app, and that app is patient has got that app in his phone, right? So he goes home with that wireless biosensor patch and that iLive app, and say, suppose, I'll give you an example. If the patient has got high blood pressure, right? His blood pressure is, say, 180, right? So immediately what will happen is, as soon as the blood pressure goes more than 160, this app will give an alarm. It will give a red alert there, right? Your blood pressure is too high. If the red alert comes, our team is monitoring that patient 24/7 in real time. So in no time, our team realizes that patient's blood pressure is 180, right? And the team connects with the patient. There's a patient gets the call immediately saying that your blood pressure is high, And because our team has got all the information about the patient.
Correct. वो पूरी
Because
patient history तो होगी.
history hogi.
Hmm.
When the patient has downloaded the app, there's entire information is there along with the prescription, right? So the doctor from our team calls up the patient, tells him, you need to do this. You need to titrate your medication. आपको ये medicine जो है extra लेनी है या ये नहीं लेनी है या साथ में और चीज क्या करनी है आपको, you know, and that ensures कि उसका blood pressure जो है control हो गया. अब इस patient को किसी hospital जाने की जरूरत नहीं है.
वो घर पे बैठे-बैठे
घर पे बैठे-बैठे just with the touch of button, right? और अगर उस patient का suppose blood pressure है 150, right? So between 120 and 160, he's not getting that red alert.
Yeah.
But notification आ रहा है उसके पास, yellow notification that your blood pressure is high. Would you like to speak to the healthcare coach? And if he presses that button, he gets connected to our team, right?
Wow.
So that's the thing. So even for the diabetes, you know, patient ka blood sugar is say 350, right? So if the blood sugar goes more than 280, you know, patient gets a red alert. And what that means is our diabetes coach is going to call him immediately and tell him what needs to be done, right? If his blood sugar goes less than 80, in that case also he's getting a call from our diabetes coach, right?
Wow.
So that way, all these chronic health conditions like especially hypertension, diabetes and underlying heart diseases, you know, they can be treated while patient is sitting at home, right?
And let's say it's a patient जो जिनका नहीं हुआ है, you know, जिनको नहीं लगे हैं stents, जिनको heart attack नहीं आया, this can just be a preventative thing also that people can do.
Absolutely. Not only for the patients who have got underlying heart disease, but imagine, you know, patients. This can be your grandmother, right? आपकी grandmother, आपकी नानी, आपकी दादी, वो उनको high blood pressure होगा,
हाँ है.
right?
सबकी नानी दादी को
Right,
high
उनको
blood pressure है, diabetes
So
है.
63% of the geriatric population, right,
Yeah.
has got hypertension.
Yeah.
And almost 15 to 20% of the population is having diabetes. So we are saying that, you know, for those patients who are suffering from chronic health conditions or for the geriatric patients, you know, you don't need to go to hospital. We are your constant companions. We'll take care of you. Don't worry. You don't need to come to the hospitals. And this service, we have already used this service in 5 minutes of our patients. And I can tell you, this has reduced the hospital admissions as well as the complication rates there. And this is such an easy to use thing, and patients really find this has changed their lives completely.
Insurance companies will not be happy.
Yeah. No, but insurance companies will be happy. You know how? You know, because imagine when the people are utilizing this service, what will happen is, you know, there are a lot of heart attacks that can be prevented, right? A lot of health ailments can be prevented. You know, you can prevent so many people going into, you know, hyperglycemic coma, the diabetic patients, right? All the complications of chronic health diseases can be prevented. So ultimately, those insurance companies, you know, they don't have to pay hefty bills, you know, for their hospital admissions and all that.
But
so they'll be saving a lot.
Disappointed कि मतलब overall अगर population ही healthier हो रही है तो फिर उनका business थोड़ा सा.
People will take insurance, but the insurance companies would not have to pay their hospital bills. So
and hopefully in the next 2-3 decades, like, you know, in general, the health of our country only is better.
It's better.
Sir, मतलब you've done such complicated procedures. आपने एक डबल लंग ट्रांसप्लांट भी करा है, आपने पता नहीं कितने ही यू नो कॉम्प्लिकेटेड सर्जरीज करी हैं. आई डेफिनेटली वांट टू टॉक अबाउट हाउ मच यू डू एज सर्विस and why you were motivated to do it, and why you think that's important to do. And I want you to talk a little bit about it, because I know that you've done, if I'm not wrong, 1,000 open heart surgeries.
Yeah, for underprivileged community, yes.
It's unbelievable. It's one of the things that I admire so much about you, and I know that you would be hesitant to talk about it, but just tell people why it's important to have this kind of a mindset.
As doctors, you know, I think it's our responsibility to be connected to the society, isn't it? So I did my MBBS from Banaras Hindu University. Can you take a guess? You know, how much money was spent on my education? Like, how much did I pay?
No idea. Apparently, मतलब मैं तो अभी के figures quote करूँगी कि जितने कंपेरेटिव एग्जाम्स वगैरह होते हैं, हम बोलते हैं कि ऑलमोस्ट 1 crore रुपीस लग जाते हैं टू क्रैक दैट सीट.
Right.
बट आई डोंट नो बैक इन द 90s कितना था.
Right. Do you know how much money would I would have spent, or my father would have spent on my education? You know, the MBBS.
Lakhs में तो होगा.
Lakhs mein?
हाँ.
Yeah. So I'll tell you. So the number is 1,500 rupees.
1,500 rupees for your entire MBBS.
Exactly. Yeah.
How?
So we had three professionals, right? Three professionals means, 1.5 years for one professional in the MBBS. It's still the same. The course is same, right? So for one professional, the tuition fee was 500 rupees, and that's all you have to pay, right? And there are three professionals, so the total fee is 1,500 rupees.
एक साल
So
की.
I paid 1,500 rupees to finish my MBBS from a government institute, of repute. Banaras Hindu University is considered to be one of the best known institutions for doing an MBBS, right? And I had to spend only 1,500 rupees for that,
One second,
right?
1,500 rupees per year or 1,500
No,
rupees in
total, total, right?
But 500 रुपए, aren't the teachers underpaid then?
Yeah, so that's the thing, So now you think about it. Think about it. So the education was not it was cheaper. It was not cheaper, right? It was made cheaper. Who bore the brunt?
The government.
The government, right?
Yeah.
And government means what? Where did the money come from?
People, taxpayers,
People, right?
yeah.
The taxpayers, right? So it was the taxpayers who paid
your
that
tuition
amount.
Fee.
Yeah. The taxpayers paid my tuition fee, right?
Hmm.
How would I be able to finish my MBBS in 1,500 rupees? Not possible, right? In today's time, if you see,
Correct.
You yourself said, right? The amount you said is
हाँ,
huge.
ये तो मैंने recently पढ़ा है अभी.
Right,
हाँ.
right. But then that's not the case for the government institutions, the government hospitals. And I can tell you, the government doctors are the most reputed ones, right?
Yeah.
Most of the big doctors that you see today, they're all pass outs from government hospitals.
100%.
They're not the private ones, right?
No, in fact, like the 1 crore figure also came from an article that I had read that government अच्छे हॉस्पिटल में
Government
सीट
के अच्छे
लेने के
hospitals,
लिए
yeah,
जो
it is 1
कोचिंग
crore
में जाना
now.
है नीट क्रैक करने के लिए
Right,
उतने पैसे लग जाते हैं.
Right. So, and this was not, I was not an isolated case. Same was true for All India Institute also, Zipmer also, for Aligarh Muslim University. You name a medical college, the government medical college, the fees was just the same, right? So, आप 1,500 रुपए में आपकी फीस किसने पे की है? सोसाइटी ने, not the taxpayers, the society, right?
Correct.
तो सोसाइटी ने जब आपकी एजुकेशन को पे किया है, तो आप कैसे जो है ये बोल सकते हैं कि नहीं मैं तो जो है सोसाइटी को अब मैं जो है you have to pay back to the society, isn't it then?
Yeah.
Right.
Especially
So
वो सोसाइटी जो डॉक्टर्स को भगवान मानते हैं, मतलब हमारे यहाँ पे डॉक्टर्स को तो भगवान का दर्जा दिया जाता है because they're life savers.
Yeah, there was a time, and I think things have changed drastically from those earlier times. Those were the times when there used to be the doctors, the small nursing homes in the cities, and these doctors were considered more like a family doctors, right?
Yeah.
People would come to them not only for getting themselves treated, but घर में भी कोई problem होगी तो वो भी doctor से discuss करेंगे, right? So they used to be their mentors, right? Things have changed from then. Now it's a corporate world, setup, right? Yeah. It's corporate setup. With the introduction of corporates, into the healthcare, things have really changed, right? The business has come into force, and that has changed people's perception and also the relationship between the doctors and the patients. That has changed. Patients have started looking at doctors in a very different view.
पैसे लेने के लिए बैठे.
Exactly. So it's not the doctor who takes that paisa, isn't it?
Of course.
The corporate system, right?
Yeah, true.
The billing managers sitting there, right? The finance people sitting there who have no connection with the medical world, isn't it? So वो एक disconnect हो जाता है, right? So then my point was, जब society ने हमारे पढ़ाई के लिए जो है पे किया है, and what we are today is because of that, right? अगर वो हमें जो है वहीं पे exorbitant amount पे करना पड़ता 1 crore, right? कर पाते हम लोग? नहीं कर पाते. isn't it? So we are here because of the society. So we have to give back to the society now, right? So that's why I think it is the responsibility of each and every doctor to give back to the society. And how can we give back, right? आपको अपनी जेब से पैसा खर्च नहीं करना है, राइट? ऐसा नहीं है कि आपको अपनी आधी सैलरी जो है दे देनी है पेशेंट्स को ट्रीट करने के लिए. इनफैक्ट आपकी आधी सैलरी इतनी सफिशिएंट नहीं होगी कि बहुत सारे लोगों को आप हेल्प कर पाओ, isn't it? But you have reached a level where your network is significant enough and you can mobilize the resources to help those patients out, right? So one heart surgery costs around 3.5 to 5 lakh rupees, right? And if you think about it, you know, how would you help 1,000 patients, right? It's a huge amount, right? But we've been able to do that because we have got good people.
That's about 50 crore rupees.
Yeah, so we've got good people associated with us, and we've been able to tell the stories to people that, you know, so say somebody, if you tell you or your dad, right, that, you know, would you be able to help, you know, at least 5 patients in a year?
Yeah, of
right?
course.
You would happily do that,
100%.
right? And same is true for, you know, everybody, you know, who is worthy of helping people. People want to help.
Yeah.
So that's the one thing, right? People who has the capability to help, they want to help poor people, right? They want them to get treated. They want to help in their own capacity. And rarely ever did I meet somebody who said flatly, no, that we will not be able to help this cause, right?
मतलब वो अब जो बैग लेने वो ले सकते हो उसमें, वो इससे अच्छा तो किसी की पूरी लाइफ ही सेव कर लो.
बिल्कुल बिल्कुल. So what happened was in 2018, 2017, I think, 17. So हमने एक हेल्थ कैंप था उत्तराखंड में. This was in a very remote area, you know, in Uttarakhand. We did a health camp there. It was there were like thousands of people, you know, who came in there. The people from villages and far-flung areas. और ये सब लोग जो है उसमें से हार्ट डिजीज, आई वाज सरप्राइज्ड एंड शॉक्ड टू सी देयर वर सो मेनी पीपल विद द रूमेटिक हार्ट डिजीज, जिनको जो है हार्ट के वेल्व्स में प्रॉब्लम थी, जिनको जो है हार्ट के वेल्व्स, दो वेल्व्स खराब हैं और हार्ट फेलियर में जो है दे आर लीडिंग देयर लाइफ, राइट? शॉर्टनेस ऑफ ब्रेथ है, पैर में सूजन है, यू नो, एंड दे आर हैविंग, यू नो, एडवांस्ड रूमेटिक हार्ट डिजीज. और वहाँ पे इन पेशेंट्स के पास even diagnose tak nahi hue wo patient, right? There's not a facility where these patients can even have an echocardiogram, right?
Yeah.
So that's the problem, and these patients were very sick. So when I saw them, तो मैंने जो है वहाँ जो organizers थे उनको बोला कि ये patients तो sick हैं काफ़ी, है ना, इनको ऑपरेशन की ज़रूरत है. तो वो सारे पेशेंट स्क्रीन हुए, करीब जो है आई थिंक देयर वर 12 or 13 पेशेंट्स जो स्क्रीन हुए कि उनको हार्ट की डिजीज़ है, एडवांस्ड स्टेज में जो है ये हार्ट फेलियर है, इनको वैल्व्स आर नॉट वर्किंग फाइन, राइट? सो देन वो जो ऑर्गेनाइजर्स थे उन्होंने बोला सर इनका जो है ऑपरेशन के लिए हम क्या आप वहाँ दिल्ली में ऑपरेशन करेंगे इनका? मैंने कहा बिल्कुल करेंगे ऑपरेशन. तो मैंने उनसे पूछा कि इनका जो है फाइनेंस का क्या सिचुएशन है, तो उन्होंने बोला कि जो है दे विल बी एबल टू हेल्प सम ऑफ दीज पेशेंट्स, राइट? आई सेड ओके देन कॉल देम हियर, राइट? सो पेशेंट्स जो है देन आई केम बैक फ्रॉम देयर एंड फॉरगॉट अबाउट द इंसिडेंट, एंड यू नो एज यूजुअल अपने डे टू डे उसमें जो है वन फाइन मॉर्निंग, यू नो, आई गॉट अ कॉल फ्रॉम द सेम ऑर्गेनाइजर सेइंग सर आप कहाँ हैं? मैंने कहा मैं अब हॉस्पिटल पहुँच रहा हूँ. दिस वाज 7 o'clock इन द मॉर्निंग. बोले सर हम हॉस्पिटल आ गए. मैंने कहा ठीक है, पर सो मैंने कहा व्हाट हैपेंड? सो वो सारे पेशेंट्स जो थे वो 12-13 पेशेंट्स हम उनको जो है बस में लेके आ गए. Then I said, okay, I'm coming there. So I saw these patients, you know, they're sick patients, obviously needed operation. So I asked him, you know, all of these patients need operation, right? And urgently so. But then, you know,
पैसे
कहाँ से आएंगे? आपने फंड्स की क्या व्यवस्था की है? तो बोले सर इनको तो जो है इतना भी पैसा नहीं था कि ये बस का टिकट दे पाएँ, तो हमने एक बस की और ले आए इनको यहाँ. और वे बोले कि जो है हमारे सर वो हमारे फाउंडेशन में भी प्रॉब्लम चल रही है, तो हम तो नहीं कर पाएंगे इनका वो, लेकिन अब ये आ गए, आप देख लो. एंड दे वर देयर, राइट?
कितने लोग थे?
दे वर 13 पेशेंट्स, राइट? अब वो पूरी बस लेके आ गए थे वो पेशेंट्स की, राइट? So then I spoke to my hospital CEO. I said, no, this is a problem. I've got so many patients and they need operation, right? So he was kind enough. He said, डॉक्टर साहब मैं कोशिश करता हूँ अपनी तरफ से, है ना, देखते हैं क्या कर सकते हैं. And then they approved for 2 of those patients, right? So 2 पेशेंट उन्होंने जो है अप्रूव किए कि उनकी जो है फ्री ऑफ कॉस्ट सर्जरी कराएंगे. एंड ऑफ कोर्स वी डिड ओपन हार्ट सर्जरी फॉर देम. बाकी जो पेशेंट्स थे उनका क्या करें, राइट? सो हमने उनको गवर्नमेंट हॉस्पिटल में बात की, राइट? वो गवर्नमेंट हॉस्पिटल्स में वेटिंग लिस्ट बहुत लंबी है. सो देयर द डॉक्टर सेड these patients cannot be operated अभी वेटिंग में जाएंगे whenever their time comes them. But they were very sick, they required operation urgently, right? And हमने कुछ 2 और पेशेंट्स के लिए फंड अरेंज किए, इधर उधर लोगों से बात की, हमारे अपने ही डॉक्टर्स में फंड कलेक्शन किया. एंड अल्टीमेटली वी वर एबल टू गेट दीज 2 more पेशेंट्स. सो ओवरऑल 4 पेशेंट्स हमने ऑपरेट किए. रेस्ट ऑफ द पेशेंट्स मैं अपने सीईओ से 2-3 बार उसके बाद बात करने गया, तो जितनी बार मैं जाऊं वो दूसरी तरफ अपना रास्ता बदल दे, है ना. उसको समझ में आ गया कि ये सेम चीज के लिए बात करने आया है, तो एंड ऑब्वियसली आई वुड नॉट बी एबल टू हेल्प हिम. सो आई रिकग्नाइज वेरी क्लियरली दैट ये होगा नहीं हॉस्पिटल में इनका कुछ अभी. So then, so I had to tell these organizers, I would tell them that 4 पेशेंट तो मैं किसी तरह से कर रहा हूँ, बट इसके बियॉन्ड मेरी कैपेबिलिटी नहीं है, है ना. हॉस्पिटल से भी मैंने बात की है, गवर्नमेंट हॉस्पिटल्स में भी बात की है, बट हो नहीं रहा है. एंड these patients went back, right? I felt bad for it कि ये I was not able to help these patients, right? 2 months down the line, I inquired the same organizer, what happened to these patients, and he said, 3 of these patients actually died, right? They could not survive, right? And this was something like a blow on my face. I figured out that if I was not able to save these patients' lives, what is the what did I do? What use is it, right? Uh, being a heart surgeon, having those skills to save all of those lives, right? And I could not utilize my skills to save those lives, right? So that was a blow to me. And then I recognized, that I have to make an effort, utilize my network and try to help these people, right? And that was 2017 or 18, I think. We initiated a trust, and our role was just to connect the patients to the people who are willing to help.
Yeah.
And the system was made so smooth that any poor patient would come to us for surgery, and he doesn't have to go to any office or anywhere, right? We would get him admitted, operate him tomorrow, right? And he was discharged in 5 days' time, right? His documents and everything, our team is so efficient, they do everything for the patient,
Wow.
and things are very smooth, So we have done more than 1,000 patients, who were really poor, could not afford the surgery, and you wouldn't believe, not even in one patient did it happen that we were not able to organize the funds, right? Almost for every patient we were able to organize funds, not a problem at all. So what I mean to say, and that's true for all the doctors, if any doctor decides, and he utilizes his network, people come forward, your own patients will come forward. Patients who got operated, they'll come forward. Okay, we got operated, we'll ensure that,
मतलब आई एम अज्यूमिंग समवन फ्रॉम प्रिविलेज जिसका आपने बहुत ही कॉम्प्लिकेटेड हार्ट ट्रांसप्लांट करा है, आई एम श्योर दे विल बी मोर देन विलिंग टू हेल्प समवन विद एन ओपन हार्ट सर्जरी.
Absolutely.
आपको हम रॉबिन हुड बोल सकते हैं फिर.
Not at all. No. See how I think, मुझे लगता है कि मैं सिर्फ लोगों को कनेक्ट कर रहा हूँ पेशेंट्स के साथ. लोग हेल्प करना चाहते हैं, राइट? बट उनको पता ही नहीं है कहाँ हेल्प करनी है, राइट? They'll donate in, some charity which they don't even know, whether it's charity or not, right? But here, we just connect that to the patient. पेशेंट के सारे डॉक्यूमेंट्स उनको जाते हैं, सब पता है उनको, जो है पेशेंट की फाइनेंशियल सिचुएशन उसको पता है, उनको पता है, राइट? एंड देन व्हाट दे आर डूइंग इज, जो पेशेंट का बिल हुआ, राइट? सो फर्स्ट वी नेगोशिएट विद द हॉस्पिटल. आप ये पुअर पेशेंट है, राइट?
मत करो इतना चार्ज.
They cannot be charged as you charge your cash patients or TPA patients, right? Give a nominal rate, right? And the hospitals are, they consider that, right? So एक nominal charge उन्होंने दिया है, right? And then जो भी bill आता है, that bill gets paid by the,
the helper.
The helper, yeah.
That's phenomenal.
तो हमने क्या किया? हमने तो सिर्फ connect किया, right? हमने और कुछ नहीं किया.
नहीं, but to even think this way, I think it's a rarity. मतलब मुझे नहीं लगता कि सब ऐसे सोचते हैं.
Right.
So I think it's commendable that you're doing all of this.
I just want to highlight, what is the situation of healthcare in our country. We are doing very good now. Technology is really picking up. Healthcare is growing by leaps and bounds. आपके पास अगर wealth है, या आप इंश्योरेंस से covered हैं, तो health is easy for you, right? But most of the population, which is living in the rural areas or in villages, for them, health is inaccessible, right? So, example मैं देता हूँ, एक patient हमारा जो है, so I was sitting in the OPD, एक patient आया, वो देखने से ही लग रहा था कि इसके पास कुछ, is very economically deprived section, So, उसको जो है हमने देखा उसके हार्ट के 2 वेल्व्स खराब थे, राइट? सो हमने अगेन उससे पूछा कि भाई ये तो ऑपरेशन की ज़रूरत है आपको, तो आपने ये तो काफ़ी एडवांस स्टेज में आप हैं अभी, तो आपको किसी ने ऑपरेशन के लिए सजेस्ट नहीं किया. तो वो बोला कि जो है 15 साल पहले जो है उसने जो है ऑल इंडिया इंस्टीट्यूट में दिखाया था, एंड ऑब्वियसली ही वाज पुट ऑन अ वेटिंग लिस्ट देयर, एंड ही वाज फ्रॉम आगरा. आगरा से भी काफ़ी आगे जो है एक गाँव था, वहाँ पे था. तो हमने उससे पूछा कि अब जो है ये 15 साल क्यों लगे आपको जो है यहाँ पहुँचने में? तो बोला कि पहले दिखाया था ऑल इंडिया इंस्टीट्यूट में, और फिर उसके बाद वेटिंग में नंबर आया. वहाँ पे भी ऑल इंडिया इंस्टीट्यूट में भी अगर आपका ऑपरेशन है तो यू हैव टू पे सर्टेन अमाउंट, राइट? इट्स नॉट फ्री. नाउ दिस गाय वाज अ बार्बर, और बार्बर भी कौन सा? ये जो है गाँव में जो पेड़ के नीचे जो बाल काटते हैं, वो एक छोटा सा वो लगा के जो है वहाँ पे बाल काटता था, है ना? उसकी इनकम, वुड यू बिलीव, हिज इनकम वाज, तो हमने उससे पूछा कि भाई आप जो है एक हेयर कट का कितना चार्ज करते हो? तो इसे 10 रुपीज, राइट? एंड कितने कर लेते हो दिन भर में? तो बोला 7 to 8 लोग, है ना? सो इमेजिन हिज इनकम, व्हाट वुड बी हिज इनकम? 80 रुपए एक दिन की, राइट? So in a month, he is only earning 2,500, 3,000 rupees. If he is working with the full force. So now imagine this man living with the very dire heart condition, who requires this heart surgery, open heart surgery. This surgery, where 2 valves are to be replaced, would cost him, around 5.5 to 6 lakh rupees easily, right? Where would he get that 5.5 to 6 lakh rupees? He cannot, right? So this took him 15 years to have that courage to move from his village to come to our hospital and show us, right? And with a belief that we would be able to help him, right? We got this patient admitted, and the next day this patient got operated, and 7 days he was out, right? Went back to his home. So the distance from Agra to Delhi is only 3 hours. But to travel this distance of 3 hours, it took him 15 years. So this is the condition of healthcare in our country, right?
Very unfortunate.
Yeah. आज के टाइम पे हार्ट ट्रांसप्लांट के आउटकम्स बहुत अच्छे हैं, right? So more than 90% of the patients, they live a absolutely phenomenal life, right? So, but again, जो awareness है ट्रांसप्लांट के लिए हमारी कंट्री में काफ़ी लो है, राइट? एज अपोज टू द वेस्ट में अवेयरनेस बहुत ज़्यादा है, लोगों को पता है कि ट्रांसप्लांट क्या चीज़ होती है, इट्स दे आर यूज्ड टू इट.
बट isn't it true कि लोग मेडिकल टूरिज्म, बिकॉज इट्स cheaper to do a heart transplant in India,
right?
That a lot of people from abroad come to actually get it done.
Yeah, that's right. But again, for international patients, it's very difficult to get the organs. Even for domestic patients, it's difficult to get organs.
What is the procedure to get an organ?
Yeah, so this is, so now we are talking about the brain dead donation. Brain dead donation is for the organs like heart, lung, kidney, liver. When a patient is declared brain dead, उसको हेड इंजरी हुआ है, रोड ट्रैफिक एक्सीडेंट हुआ है, वो हॉस्पिटल में है, वेंटिलेटर पे है, और वो ब्रेन डेड तो हो गया है, बट बाकी ऑर्गन सब ठीक चल रहे हैं, राइट? हार्ट इज डूइंग गुड, lungs are doing good, kidney is doing good. So that is the ideal donor, Now his family, तो जो ICU फिजिशियन है, वो उनकी फैमिली से बात करता है कि पेशेंट तो ब्रेन डेड है, बट would you like to donate his organs? If he says yes, then you can imagine, his yes means
कितने लोगों को लाइफ मिल गई?
8 lives are saved. 8 lives are saved directly, right? You can save a heart, 2 lungs, liver can be split into 2, kidneys, 2 kidneys, right? Pancreas, right? Small intestine, small bowel, right? So 8 lives are directly saved, and there are many other lives that are helped, right?
Yeah.
So all these tissues can go to different people, right? Like cornea can go to somebody, your heart valves can go to somebody, your skin can go to the burn patients, right? So many organs can go and tissues can go to different people, right? So it's a huge social service, right? Yeah. It's just how you convince the patient's relatives. And it does not depends on the education of the patient. तो पहले बोलते थे कि जो है पेशेंट अगर जो है इलिटरेट हैं, ब्रेन डेड डोनर के जो रिलेटिव्स हैं वो इलिटरेट हैं, तो वो नहीं डोनेट करेंगे. लेकिन वेरी सरप्राइजिंग, मैं चेन्नई में था, रेगुलरली ऑर्गन ट्रांसप्लांट्स करता था, और जो ब्रेन डेड डोनर्स हैं उनके कांटेक्ट में आते हैं हम, राइट? हमें पता है. यू विल बी सरप्राइज्ड, जो इलिटरेट लोग हैं उनको भी जब आप एक्सप्लेन करते हैं तो सेम कन्वर्जन रेट है एज अपोज टू द लिटरेट पीपल, राइट? दे अंडरस्टैंड. सो ह्यूमन जो इमोशंस हैं वो लिटरेसी पे डिपेंड नहीं है यहाँ पे. A very educated person can say no to the brain donation, but if you explain properly, methodically to a illiterate person also, he would understand that. So rate of conversion is regardless of the literacy, that we have seen, and there are studies to prove that. Yeah. And also there is a misconception कि नॉर्थ में लोगों में ऑर्गन डोनेशन के लिए अवेयरनेस कम है, तो शायद जो है ऑर्गन डोनर्स जो है मिलने मुश्किल है नॉर्थ में. यस, नॉर्थ में ऑर्गन्स मिलने मुश्किल हैं बिकॉज ऑफ अदर रीजंस, राइट? बट नॉट बिकॉज पेशेंट्स आर नॉट अवेयर. इफ यू स्पीक टू द फैमिली ऑफ अ ब्रेन डेड डोनर, द कन्वर्जन रेट इज सिमिलर in Chennai, Pune, Delhi, or Chandigarh. There's a study to back it up also.
Do you remember your first transplant surgery?
Yes, I do. Yeah.
How were you feeling after that?
Phenomenal. It's very phenomenal to see that, the patient who was struggling with a bad heart, with a almost, the heart which is just, so if you see, our heart beats like this.
Yeah.
But if you see in a patient who has got beaten up heart, the heart just beats like this. It is just hanging by a thread, right?
Yeah.
And once you give him a good heart, right? After that, once you take off the cross clamp and you see that heart beating immediately, right? So that gives you a great confidence and a different level of happiness, that now the patient is going to live many years and decades.
आपने कभी ग्रेज एनाटॉमी टाइप का शो देखा है?
Yes.
How realistic do you think it is?
It was close to reality.
Really?
Yes. Yeah.
I always thought that, see, for someone like me who has nothing to do with medicine, अभी वो कुछ भी बोल रहे हैं तो मुझे ठीक ही लगेगा. But I always wondered कि जो actually medical profession में बहुत proficient है, उनको ये accurate लगता है कि नहीं?
Yeah. It was close to reality. See, there are technical things that could differ, right?
That's
they may say certain things, which are absolutely not relevant, right? But at the same time, the theme is more or less close. So they would have done research, extensive research, but obviously, whatever amount of research do you do, if you are not from that fraternity, you would miss certain things, right?
Yeah.
And that becomes apparent. The professional watches that, he understands, he will be forgiving, right? Because if I watch somebody doing heart surgery, if he is not a heart surgeon, right? I would be forgiving. I would say that, okay, well, how would he know the intricacies of that, right?
So you like Christina Yang? She was a cardiothoracic surgeon. And I used to really like her. I just loved her spirit.
Right.
The
Right,
first
right, right.
10, 12 seasons I've seen, उसके बाद मैंने छोड़
Yeah,
दिया.
yeah. So the hard work that they show,
Hmm.
the passion for the surgery that
The
they show
precision
there, the
also.
precision also,
Yeah.
that's all true, right?
Hmm.
So
Nice.
it was well researched. Yeah.
Hmm. So one last question I want to ask you is that, matlab, again, in the last, I would say, decade or so,
Right,
um, I have at least around me observed uh, that people are very irresponsible when it comes to just popping in medicines.
right,
है ना, लाइक कुछ तो चलो प्रिस्क्रिप्शन बेस्ड होती हैं जो नहीं मिलती होंगी शायद,
right,
बट जो नॉन प्रिस्क्रिप्शन बेस्ड होती हैं,
right.
यू नो द बेसिक सॉर्ट ऑफ
Painkillers.
the painkillers, you know, we won't
Yeah.
name the most common 500
Right,
one,
right.
but does that impact the heart, like the antacids, the painkillers that people just take without thinking?
Right. Yeah. So there are certain medicines. So first of all, uh, self-medication is a bad thing. Uh, as an example, I'll tell you a patient that I recently did bypass operation for. One day before bypass surgery, we came to know that, he was taking steroids for almost 2 years
खुद से.
for a skin condition. Somebody told him that, you take the steroid, and he was taking this prednisone for almost 2 years. Can you imagine? And his skin has become so fragile, and he's so prone to infections, right? So now his wounds would not heal properly because he has taken steroids for so long. And self-medication. Like somebody told him that, take steroids, and he just started taking that. Didn't even consult the doctor after that. And steroid is such a bad medicine, if you take it for more than a week, 2 weeks time, it can cause havoc with your health.
Yeah.
And imagine this patient was taking it for
2
whole
years.
2 years.
Yeah.
So we had, and then the challenge was we had to do a bypass operation along with a valve replacement, a very complex operation on this patient, right? Where we know that the skin is so fragile, the tissues are so fragile, healing would be a problem there. And on top of it, he was diabetic also. So many comorbidities, he had. So then, that time, it becomes really a challenge, how do you deal with such a patient? And he needed surgery. If you don't do surgery, not going to make it for long.
Yeah.
So then we did surgery, but then we knew that this is not an ideal situation, not the ideal scenario. And luckily, this patient did very well, because our team is a very we have a team of experts who understand what the pathophysiology would be for a patient who has taken that long steroids, right? And ultimately, patient did very well. But again, these are certain things that can haunt you.
But
Patients
painkillers?
Painkillers, they can damage your kidneys to a level that you can have a renal failure. If you undergo a bypass operation or any intervention, even if you don't have any intervention, your creatinine level can really go up, and you can be on dialysis. If you continue with the inadvertent use of these non-steroidal anti-inflammatory drugs, painkillers. There are patients, who pop up pills, for everything. Patients with chronic backache, they wouldn't ask their doctors, right? When they have backache, they will have it, and they will have it, twice in a day for months together. Imagine the kind of insult the kidney gets, right?
Yeah, true.
That's not good. Self-medication is bad. We should be wary of taking medicines on our own. Always consult a doctor.
Yeah, no, I agree.
Google also would not help because
Yeah,
it'll give
Google
very
though will probably tell you you're about to die. So, like I think it's best to actually just go to a specialist.
Yeah, absolutely.
Yeah, I think now everybody in the generation of Google is now self-medicating only. But
absolutely.
I don't think that's
Sometimes
a good idea.
patients tell us, exactly, what they are anticipating, and at that time it feels like, they know more than you, But then the thing is, Google will give you unfiltered information, isn't it? Right?
True.
That can never compensate for the years of training and hard work that goes on.
Yeah.
In order to have an expertise in that area. Right?
I agree. So you have such a busy schedule. I know you have just innumerable surgeries that you have to perform. How do you unwind after us? How do you just relax?
One is the I play. I play generally pool. I like, and I have some of the friends, who are really into pool. So I enjoy playing pool with them.
Yeah.
And then, it's not very often, like twice in a week or so. But then I most of the times, I am so late from the hospital. I come back at 9 o'clock, 10 o'clock in the night. Um, many a times, children are already asleep by then.
Yeah.
Right? I make an effort to spend whatever time I have to spend with them. Sundays I try to spend time with my family.
Yeah.
And whatever time I get, I try to play pool with the friends and like-minded people.
Nice.
So that's my way of unwinding.
That's amazing.
Yeah.
Sir, what a pleasure to chat with you today. Learned so much.
Yeah.
Definitely very inspired by, your sort of social entrepreneur angle
Right.
to do more, to serve more. Yeah, I just so many things you do. I wish, surgeons like yourself could also fix broken hearts for the younger generation. I think that would just be the cherry on
Yeah.
top. I feel like if all the sort of cardiothoracic and like heart transplant surgeons could just find a way to.
There is a broken heart syndrome.
Yeah,
You
I
know
know.
that?
I know.
Yeah. Sometimes there is a very immense level of grief,
Yeah.
that can cause the heart function to go down. 15%, 20%, 25% in the
And it's
moments of
called the
grief.
broken heart syndrome.
Broken heart syndrome. Yes, there's a term for that.
So you can
Right?
fix broken hearts.
We can fix. Yes,
Yeah.
we can fix. Yeah. There
The
are
extreme
medications to
ones.
treat those broken hearts too.
Yeah.
There really are medications to treat that.
But thank you, sir. What a pleasure. And hopefully, I'll see you very soon.
Sure.
And not with any condition or consult, but just to chit chat.
It was a pleasure to be invited to a podcast like this.
Thank you.
I look forward to have more of these podcasts in the future.
Thank you, sir.
Thank you.
Thank you. So we have a little gift for
thank you
for all the home cooked meals
thank
that you encourage us to have. These are some spices that you'll hopefully enjoy.
Okay. These look like some organic things inside.
Yeah, these are all the catch spices that you can use in your cooking
Okay.
cooking at home.
Oh, wonderful. Wonderful. Thank you so much.